Type 2 diabetes can cause high blood sugar levels. Recognizing the early symptoms and signs of this chronic disease can enable people to receive treatment earlier, thereby reducing the risk of serious complications. Type 2 diabetes is a common disease. The Centers for Disease Control and Prevention, CDC, found in a 2017 report that 30.3 million adults in the United States have diabetes. The report also estimates that 84.1 million other adults have diabetes. According to reliable CDC sources, people with prediabetes usually develop type 2 diabetes within 5 years if they do not receive treatment. In the early stages, the onset of type 2 diabetes may be gradual and the symptoms may be mild, so many people may not even realize that they have the disease. In this video, we discuss the early symptoms and signs of type 2 diabetes and the importance of early diagnosis. First, frequent urination. When blood sugar levels are high, the kidneys try to get rid of excess sugar. Cleared from the blood, this may cause a person to urinate more frequently, especially at night. Second, constant thirst. Frequent urination removes excess sugar from the blood and causes the body to lose water. Over time, this can lead to dehydration and make a person more thirsty than usual. Third, constant hunger. Persistent hunger or thirst may be an early symptom. Diabetics often cannot get enough energy from the food they eat. The digestive system breaks down food into simple sugars called glucose, which the body uses as fuel. For diabetics, this glucose is not enough. As a result, regardless of how long they have eaten recently, people with type 2 diabetes usually experience constant hunger. Fourth, exhaustion. Type 2 diabetes affects a person's energy level, making them feel very tired. This fatigue is caused by the insufficient supply of blood sugar in human cells. Fifth, blurred vision. Too much blood sugar can damage the tiny blood vessels in the eyes, which can cause blurred vision. If diabetic patients are left untreated, the damage to these blood vessels may become more severe, eventually leading to irreversible vision loss. Sixth, wounds heal slowly. High blood sugar damages the body's nerves and blood vessels, thereby affecting blood flow. As a result, even small wounds can take weeks or months to heal. Slow wound healing also increases the risk of infection. Seventh, numbness or pain in hands or feet. People with type 2 diabetes may feel pain, tingling, or numbness in their hands and feet. This condition is called neuropathy, and it will get worse. Eighth, dark spots on the skin. Dark spots on the skin that form on the folds of the neck, armpits, or groin may also mean an increased risk of diabetes. This skin disease is called acanthosis nigricans. Ninth, itching and yeast infections. Excess sugar in blood and urine provides food for yeast, which can lead to infection. Yeast infections usually occur in warm, moist skin areas, like the mouth, genitals and armpits. The affected area is usually itchy, but the person may also experience burning, redness and pain. Anyone can develop type 2 diabetes, but certain factors can increase a person's risk. These risk factors include being 45 years of age or older, living a sedentary lifestyle, being overweight or obese, eating an unhealthful diet, having a family history of diabetes, having polycystic ovary syndrome, PCOS, having a medical history of gestational diabetes, heart disease, or stroke, having prediabetes. Anyone who experiences possible signs and symptoms of diabetes should see a doctor for an evaluation, especially if they have other risk factors for developing this condition. The early detection and treatment of type 2 diabetes can improve a person's quality of life and reduce the risk of severe complications. Thank you for watching, and if you like this video, please subscribe to our channel. It greatly helps our work.